Lakeshore Drive 35 minutes, 27 from the Tri-State. Outbound is actually delay-free. The Dan Ryan inbound, 95th Street to the Burn Interchange, 23 minutes. Lakeshore Drive northbound slowing 18th to Monroe. And the Tri-State northbound's heavy from Halstead to I-80 with an accident in the left lane of the exit ramp. That's traffic. I'm Julie Cronus.
Chicago's Morning Answer continues next. AM 560 Weather Center forecast. Cloudy, cooler, high 72. Nice sleeping night ahead. Low of 60 degrees under partly cloudy skies. Right now, 64. Next news coming up at 8. Chicago's Morning Answer continues next on AM 560. The Answer.
From the Matrix Home Solutions Studios, this is Chicago's Morning Answer on AM 560. The Answer.
Listen to AM 560 The Answer online at 560theanswer.com, on the AM 560 mobile app, on your Alexa-powered smart speaker, and on TuneIn, iHeart, and on Odyssey. Only the biggest stories, only the biggest guests, and only the biggest opinions. This is AM 560 The Answer.
Top of the morning, Dan and Amy. So White House spokesman Jen Psaki said that the big guy would certainly support states who reimpose lockdowns over COVID-19. There's certainly, people have to make their own decisions out there, and out of an abundance of caution, they want to lock down their states again. The Biden administration would, of course, be deferential. The only basis to do something like that would be because of this Delta variant that people are trying to whip frenzy over. And so the question becomes, what should we know about the Delta variant? What do we know about it at present?
We know that the mainstream media every single day calls it the deadly Delta variant. And now cases are doubling in America, and that half of all cases are from the Delta.
Well, let's get a expert perspective on this. And to do so, we're pleased to be joined by Dr. Carlos Del Rio. He is the Vice President of the Infectious Diseases Society of America. He's the Professor of Medicine at Emory University School of Medicine and of Global Health and Epidemiology at Emory's Rollins School of Public Health. Dr. Del Rio, thanks for joining us. Appreciate it.
A pleasure being with you.
So what do we know about the Delta variant at present?
Well, I think, we know that it's clearly more transmissible than the original variant or the Alpha variant, a lot more transmissible, and therefore the more people are going to get infected. But we also know that the vaccines we currently have available are pretty good, and not only at preventing you from getting you infected with the Delta variant, but they are really good in preventing you from getting very sick or dying from the Delta variant. So I think if you're vaccinated, you don't have a lot to worry about. If you're not vaccinated, I think you have a lot to worry about.
But how many hospitalizations and deaths are attributed to the Delta variant? Is that even possible to find out?
It's difficult to find out, but what we know at this point in time is that you could say almost pretty much 99+% of deaths that are occurring right now in our country are occurring among people that are unvaccinated. So if you think about unvaccinated people, that's where the problem is happening. If you look at places where we have Delta variant surging, and one of them, for example, is Missouri. In Missouri, we've seen an increase of 25% in hospitalizations, and in fact, right now in the state of Missouri, there are over 1,000 people hospitalized with COVID, and many hospitals are really concerned about it. They're beginning to ask for help, ask for more ventilators, et cetera. So I think that the relationship between not having a high vaccination rate and having spread of Delta variant is going to be very clear in many places.
We should, if you're not vaccinated, you should be very concerned about the Delta variant. Is there any evidence the Delta variant is more lethal than the other iterations of COVID?
That's a very good question. There's mixed messages on that. The one thing you can say, even if it's not more lethal, you're going to see more people infected with it. And as a result of seeing more people infected, even if the mortality is the same, you're going to see more deaths just because of the numbers, right? But there's some data from Scotland suggesting that it's more severe, particularly in people that have comorbidities. So if you're older, if you're obese, if you have hypertension, diabetes, you may be at bigger risk of getting sick with the Delta variant.
And yet, when this characterizations are made about what you should be afraid of, you should be concerned about if you're unvaccinated, this and that. Doesn't there need to be gradations in this conversation? I know Tony Fauci is terrible at offering gradations and qualifiers and treating everybody as similarly situated when they clearly are not. And, oh, by the way, in terms of how afraid you should be under any circumstances, the infection fatality rate under 70 is running at about 0.05%.
Right.
So,
but you have to remember this is more.
So just like relative to this, like what you should be circumspect about in your daily life, all other threats and causes of sickness and death. Doesn't this need a little bit more context than just saying be afraid of this?
Yes, but you have to remember that there's more than just getting sick and dying from COVID. We've seen plenty of people with the so-called long COVID, with long-term complications of COVID. I have a personal friend who had COVID, who had a mild COVID. She's a young woman, and a year later, she still cannot smell. She still cannot taste food. She has a lot of trouble eating, and this is all long-term consequence of COVID. So you got to also remember the impact that this can have in your sort of day-to-day life, basically.
Yeah, there's some question, though, even about long COVID. I mean, all of these are matters of some scientific debate. I know it's not presented that way often, but I mean, there was a good piece by a psychiatrist from McMaster University up there in strange Brewland, north of the border in Canada, talking about these symptoms of long COVID, chronic fatigue, and so on and so forth. There's some questions about whether this is psychosomatic or it's actually physiological and related to having been infected by COVID.
There's no doubt about that. I think there's a combination of, you got to remember people have been very stressed, are depressed. There's no doubt that there may be a combination of things, but I do think that there is some chronic, long-term impact of the virus, particularly in heart, particularly in the brain. And finally, as I said, the olfactory nerve dysfunction is something that is very clear. We have known from the very beginning, and tell people that, used to tell people a long time ago that my early morning COVID test was smelling my coffee. If I can smell my coffee, I probably didn't have COVID. It was a very good way to predict who had COVID and who hadn't. I tell you, the people that I've seen with difficulties in long-term, inability to recover smell, it's probably pretty significant. And you will be surprised how many young people. I mean, I was talking to this other person who says, I can't taste. Beer tastes horrible. I can't drink a beer. I can't. They're not going to die, but I mean, it's just an impact on life that is not trivial.
But there's I know 2 long haulers supposedly, but once they received their second vaccination, they got their sense of smell back. They got their energy back. They got their taste back.
That's a very good point. And some of us have seen that. Some of us have seen the I would say the recovery of symptoms after you get vaccinated. So that's why I tell people who have had COVID, you still need to get vaccinated.
And what about the therapeutics and completely walking away from this conversation? Not you, but so many people have. Actually, I referenced earlier in the program, Matt Taibbi had a good investigative report at his Substack about ivermectin and it being sort of censored by, not sort of, it being a discussion of it being censored by the big tech companies. And we were talking about therapeutics before we had a vaccine and talking about them seriously. Now there's no discussion of therapeutics. Does that strike you as odd at all?
No, it's actually, there is discussion, and I tell you, I'm involved in some of the studies in therapeutics. There are a couple of really interesting drugs out there, including some oral drugs. And I think in the future, I can see in the future of COVID having a pill very similar to what we have for the flu, the Tamiflu, something that you can just take and will take care of it. And I think, the development of those drugs is actually happening.
Okay, well, that's encouraging. And on the vaccines, there was this story out. And again, I'm not going to do with the vaccines what so many COVIDians did with the virus and extrapolate from the anecdotal to make broad, sweeping generalizations. But I am going to raise the question. There's a story out of Michigan this week. A Michigan boy, young man, 13-year-old, died 3 days after getting the COVID-19 vaccine. The CDC is investigating. Are we getting, in your view, as a professional and expert, are we getting sort of the straight dope from CDC to the extent possible about the adverse outcomes associated with the vaccines and having the conversation we should be having about those potential adverse outcomes?
No, absolutely. I think we are. I mean, I can tell you that the advisory committee immunizations, I think the system of monitoring vaccinations in our country and side effects of vaccines is incredibly robust. It's probably one of the best systems, if not the best system in the world. You have to remember, though, that, yes, maybe this one person had a side effect, but think about the number of people who have died of COVID in our country, and think about the number of young people who have died of COVID in our country.
We've had 3 COVID deaths in Chicago, and they all had severe comorbidities. So
under the age of 18.
Under the age of 18, yeah. I'm saying.
Okay.
Yeah.
Yeah, but the larger point, Doctor, is you're talking about trade-offs. We haven't been able to talk about trade-offs for a while. Until we got the vaccine, we couldn't talk about trade-offs with respect to COVID and all of the other vagaries of living in this mortal world. Now we're talking about trade-offs, but we don't get to have the conversation about trade-offs. We do, but it's not respected in many quarters. About for somebody under 12, the threat of COVID infection versus the possibility of an adverse outcome from taking one of the vaccines. What are those numbers?
Well, I think we need to have the conversation about trade-offs, and I still think that the possibility of getting COVID at this moment in the pandemic exceeds the risk of getting a problem from the vaccine. As the pandemic recedes, that equation may change.
Well, I mean, if you think about the 13-year-old kid, Jacob Slynick, the initial preliminary autopsy finding said that his heart was enlarged when he died, and that there was fluid around his heart. And this isn't the first time we've heard about this. And that's why there's a warning label now on Pfizer vaccines for kids 12 or 18 and younger.
Yeah.
And Moderna.
Yeah.
I mean, is that fair to raise as a concern? Some of the science out, and now the FDA's moved for warning labels on the vaccines. Is that how do you react to that?
Well, I think you have to look at it and say, decide on the risk. As I said, I have nephews which are young and are, one of them is 18, and we had a conversation, and he decided to get vaccinated after we had the conversation, and he's doing fine. So, I mean, I think it's not a simple decision. It's a decision that I think individuals and parents need to make and decide what's most appropriate. If I see a lot of COVID in my community, I may recommend my kids to get immunized. It really is it's a more nuisance decision than just simply saying, it's good for everybody.
Yeah, no, okay, that's fair. No,
I talked to my doctor and got my sons vaccinated too.
Exactly.
Yeah, it's absolutely fair.
I'm not going to have my governor tell me to get vaccinated.
Okay.
I'll have my doctor.
Yes.
Please.
Don't listen to politicians. Good general rule. Dr. Carlos Del Rio, Vice President of Infectious Diseases Society of America, Professor of Medicine at Emory University School of Medicine and of Global Health and Epidemiology at Emory's Rollins School of Public Health as well. Dr. Del Rio, thanks for joining us.
Pleasure being with you.
Thank you, and he joined us on our turnkey.pro answer line.
It's what Chicago is talking about. It's Chicago's Morning Answer with Dan and Amy on AM 560. The Answer.
In 2008, founder Eric Schildkraut of SAE Customs started building police cars for a local department. Today, SAE Group in Lake Moore, Illinois continues to offer the most pristine police, fire, security, and work truck installations in northern Illinois. SAE Group has the experience to equip your vehicles with just about anything, from warning lighting to camera systems, storage systems to